If you were sick in 1904, you rarely went to the doctor's office. Instead, you had a visit from the doctor. Stories abound of frontier doctors traversing throughout west central Texas, riding all night on horseback or driving horse and buggy on muddied and rutted roads to visit an ailing patient. With few hospitals and no drugstores, they were prepared to treat virtually any ailment and carried all possible curatives in their medical bag. Once in the home, the doctor would examine their patient, though their medical procedures and range of diagnoses were limited by today's standards. A fever could be gauged by a gentle touch to the forehead. Most had stethoscopes to examine the chest and lungs, but that was usually the limit as to their medical equipment. Finding a cure meant using tried and true methods of treatment, many of which dated back hundreds of years. Enemas, purgatives, and bleeding were all used by doctors who believed that harmful humors and other causes of disease must be physically removed from the patient. Poultices and plasters, applied to the body and secured by wrapping the chest or affected area with cloth, were also popular. Some remedies called for heat, which led to burns that only compounded your misery. Most doctors were adept at splinting and casting fractures, which were common injuries where livestock and wild horses were a staple of frontier existence. Cuts and open wounds could be sutured, and babies would be delivered. But aside from boiling water or administering whiskey, there was neither antiseptic nor a sophisticated understanding of what caused infections. For serious injuries, few anesthetics were available. Dr. John Darby Wildham of Callahan County once amputated a leg using whiskey as both an antiseptic and sedative. If home remedies were unsuccessful, a physician might turn to medication, mixing up a remedy from drugs carried in his medical satchel. Calomel, quinine, blue mass pills, ipecac, whiskey, and castor oil were commonly prescribed, with the understanding that if you really wanted it to be effective, it had to either taste or smell bad. Primitive methods notwithstanding, a visit from a doctor usually improved your chances of survival. And, regardless of whether or not they possessed professional credentials, any doctor who could save a life quickly became a valued addition to a growing frontier community.